wide, the push for more testing and the push for more complete and further concentric circles out case and contact investigations are known to be strategies that can help us both understand and be able to quickly address any new cases that we see in the community. So Cindy will talk that through a bit more after I give some information about some other things that we're doing. And we also have Amy Hockenberry, who was with us last week to talk about some of the data indicators we're seeing and the role that data will play in our next strategies moving forward. But I think one of the things that I want to talk about, because there's a number of different strategies, and what's of real importance to the health department and on my mind at the moment is how do we provide a support and assistance to businesses so they can reopen safely and feel confident that they can keep their staff and customers safe. And to that end, I have asked our Public Health Advisory Board, which represents a number of different sectors, to convene a task force. And that task force will do just that. It will convene many different sectors, businesses, representatives, employees, existing businesses that are open, that are demonstrating best practices, and start to work through some of the questions and some of the barriers for different sectors and businesses that will create challenges for them in reopening, and how we can, as a community, work through those challenges together and better understand what work still needs to happen, and what training and what resources and technical assistance still need to happen for lots of different businesses to prepare for reopening, whether that's after May 4th upon a governor's announcement or further into the future. Now is the time that we have an opportunity to plan for that and to be a partner with our businesses and our business associations in rebuilding our economy. Our goals are, of course, to control and minimize the spread of COVID, but also to ensure that people can get back to work and that businesses can reopen, because we know and we've seen the impacts on our public health system and on all of our support systems when people are out of work and unable to earn a living for their family. So obviously these are two major concerns for us, and I look forward to having continued conversations with the Public Health Advisory Board about how we can quickly convene a task force and get to work on supporting businesses. And with that, I think I'm turning it over to Amy Hockenberry.
Thanks, Erica. So today I want to provide an overview of the new data that we have available on our health department website. This is speaking to how we design some of our strategies moving forward. So first, though, I would like to talk about the data that helps us understand how COVID-19 is impacting our community. In Whatcom County, we have a mid-sized population. And so when it comes to reporting data, we often deal with what we call small number issues. Statistics are more reliable and accurate when there's a large population or sample size. Reliable data is critical in tracking how a disease is spreading, how it is affecting our community, and which segments of the population might be more greatly affected. Reliable data is also critical at helping understand if we're making a positive impact on the spread of a disease in our county. So far in Whatcom County, the number of confirmed COVID-19 cases and deaths have been relatively low. Well, this is a good thing for our community. It also means that the sample size or the number of people who have COVID-19 in Whatcom County is low enough that statistics other than case counts are not very reliable. So as our case counts have increased, we can now use more epidemiological statistics like what we have on our website and what we're sharing here. We'll be sure to post the link to this web page in the chat box. A couple of graphs that we've included display epidemiological curves, also referred as epicurves. These can provide great information about an outbreak, such as the distribution of cases over time, cases that stand out apart from overall pattern, a general sense of disease impact in our community, and how the outbreak may be spreading. We can clearly see from our epicurve that the number of new cases each week has peaked and is decreasing. This matches what we shared last week in the modeling report, which is that we've likely seen the peak of a first wave of infections. You may notice that we display that these epi curves to show the number of cases for each week as opposed to days. This is to ensure we have enough information for a good comparison over time. Please also note that the x-axis on the epi curve for confirmed cases represents time, and it shows us the date of illness started or illness onset. The data helps us to understand the spread of the disease, as well as how our current strategies might be working to slow the spread of COVID-19. Next, our website also shows the percentage of confirmed cases and deaths by sex at birth and by age category. In general, the number of confirmed cases is spread fairly evenly across adult age categories, and we've seen a higher percentage of deaths among people who are older, particularly in our most elderly adults and those who have needed elevated care. So there's just a glimpse of what we've been able to share at this point. We're very pleased to be able to provide these first data visualizations, and we'll continue to monitor the situation and provide additional information as it's relevant and available. And now I believe I'm going to be passing it over and introducing Cindy Hollinsworth, our Communicable Disease and Epidemiology Manager for our health department.
Good morning. Testing for COVID-19 is an essential element of reducing the spread of COVID-19 infection. Early on in this outbreak, testing was very limited, and we needed to focus our testing resources on people with the most severe illness and on quickly identifying clusters or outbreaks in settings like care facilities where most people live, where people most likely to have severe outcomes live. So now we see that capacity for testing is increasing. Thanks to efforts across the community, many healthcare providers and local labs have increased the availability of testing for COVID-19. And because of this, more people are able to get tested. If you think you have COVID-19 infection, you should get in touch with your primary care provider. They will screen you for symptoms and refer you for testing if your symptoms are consistent with COVID-19. Many healthcare providers in Whatcom County now offer testing at drive-through sites or clinics. If you can't get tested through your regular provider, your healthcare provider can arrange for testing through the health department. We will help find a testing option that works for you. Getting tested for COVID-19 and knowing for certain if you have it won't change the treatment for your symptoms because there aren't currently any treatments specifically designed to treat COVID-19. Getting tested for COVID-19 will allow people to take steps to isolate themselves while infectious and decrease spread to others. Getting tested for COVID-19 additionally provides information about presence of the disease in Whatcom County and gives us information needed to make decisions about relaxing or increasing social distancing measures. Having scaled up testing capacity in our community gives us more information to understand and fight the outbreak. More testing gives us better information about how the virus is being spread and who is being infected. Testing allows us to identify people who have COVID-19 infection so that they can isolate themselves and so that we can do contact investigation, also known as contact tracing, to evaluate their close contacts for symptoms. This is fundamental public health work that our team of public health nurses and disease investigators implement on a daily basis, no matter what the infectious condition is. Ultimately, contact investigations help us contain this viral infection by keeping sick people from spreading it to others. Here at the health department, we are working with our clinical partners to increase local testing opportunities by both expanding community-based testing sites for the public, as well as consulting with healthcare providers about how to set up their own testing sites. Right now, at our health department drive-through testing site, we are able to test people with symptoms of COVID-19 infection who are referred by their healthcare provider and are unable to get tested elsewhere. We are also continuing to do the essential work of testing to identify infection clusters. Our rapid response team works with congregate living facilities, that's like assisted livings and skilled nursing facilities, where there are possible cases of COVID-19. And we work to quickly identify residents and staff who might be infected, so additional infection control measures can be put in place to limit the spread of the virus. When the infection occurs in someone in a congregate living facility, especially when there are many who live there who are at more risk of severe illness, our rapid response team is activated. And we work with the agency providers to assess the living environment for elements such as availability and use of PPE, effective cleaning practices, and other infection prevention measures. We arrange for or provide rapid testing of residents and staff, sometimes on site and sometimes at our drive-through testing site. Our team can test 100 or more residents and or staff per session. The rapid assessment and testing results gives us baseline information about the extent of infection within the facility. We can then define tailored measures and work with the facility to put measures in place that will limit further spread. As Erica mentioned, widespread testing and sufficient capacity to do contact investigations will be necessary for us to begin dialing back social distancing measures and return to our normal daily lives. We're working closely with public health partners at the state level on both guidance for testing and staffing for contact investigations. We have sufficient testing capacity in our community to meet the current need. And in addition to our staff who do contact investigations as part of their daily work, we've also trained up other health department staff for this work. As we evaluate how to keep essential operations for the health department going, both our normal operations and our lead role in responding to COVID-19, we are exploring a variety of options for additional staffing that will allow us to scale up our contact investigations as needed.
Thank you, Cindy. So at this time, we're going to go ahead and open things up. If you are a member of the media and would like to ask a question, the chat feature is now open. You can go ahead and let us know there by typing in your name and your affiliation, and then you'll be called on to ask a question. Our first question is from Key with the Herald. Key, you can go ahead and unmute and ask your question.
Hi, thank you for taking my question. Quick question, did any of the 12,000 COVID-19 test kits that were recalled due to possible contamination, did any of those make their way to Whatcom County?
Yes, we did have about 1,000 of those kits here, and we had used some for a testing session. And so there's a call this morning later, as like in the next few minutes, with the state epidemiology department about the status of those test kits and tests that were done with them. But the initial press release from the State Department of Health did say that there was not concern about the results. So we're waiting for more detailed information about that now that they've had about 24 hours to work that through.
Okay, our next question is from Joe Tehan with KGMI. Joe, go ahead and ask your question.
Okay, thanks for having us. And concerning the extended living or nursing facilities, do we have proper testing or enough testing here? I mean, how is testing being done? Is it being done if there is a case that's found in one of these facilities, or are they being, are residents and workers regularly being tested? I'm curious how confident people should be if they have someone, a loved one who's in one of these facilities here in Whatcom County.
Yeah, that's a great question. Thanks for clarifying that. Early on in the response, we started working with our partners, primarily in the skilled nursing facilities, just even around their ability to collect specimens in a safe manner and get those transported to the lab. We've seen tremendous growth in ability for specimen collection and specimen processing over the last couple of weeks. And so what's happening now is our facilities, assisted livings and skilled nursing, I believe it's all of the DSHS facilities, are doing daily monitoring of their residents. And then if someone becomes symptomatic, then they can Some facilities have their own processes in place where they can collect specimens and send them to the lab. Other facilities work with us to get specimen collection materials from the state lab, and then they collect and we go ahead and send it down to the state lab. So we've got good processes in place for our facilities. And then in the event that a positive result does come back, that's where we just activate the rapid response team and get in there and do a really thorough assessment and take a look at, we could even be talking about what makes sense for cohorting, moving people who are positive together, and then who else potentially is exposed within the building.
Okay, our next question is from Denver Pratt with the Bellingham Herald. Denver, go ahead and ask your question.
Hi guys, thanks so much for holding this briefing. I just had a couple of questions. I know that staff that work at like these long-term care facilities often work in multiple care facilities. So I was wondering if there's been limits or restrictions about keeping staff within just one facility. And then my second question is, can you tell us the number of both confirmed cases and deaths that have come from the care facilities in Whatcom County versus those out in the community?
I think the data question, we'd have to follow up with you to get that one specifically. It would require looking in our database. And the staff working in multiple facilities. So on March 10th, the State Department of Health put out a directive to skilled nursing facilities to essentially go into quarantine at that time. But there was not directions about staff working in multiple facilities. So now we've seen that facilities that have cases are asking their staff, and we've asked them to have their staff not work in other facilities. And many other facilities have just taken that on to make that own request of their staff. So the group that's probably another concern is our home health agencies and our private caregivers that might go into somewhere like an assisted living to provide additional care that the facility is not able to meet. But the facilities have visitor log lists. They still have the visitors sign in and they're kind of a visitor. They're a provider. They still have to do a temperature check and symptom assessment and wear a mask just like other staff at the facility. And then we're able to track that based on who they signed in that they were seeing.
Our next question is from Robert Mittendorf with the Bellingham Herald. Robert, go ahead and ask your question. Okay, I think I had seen Robert maybe coming in and out of, maybe having some technical difficulties. So we'll go ahead and move on to Jeff with Como News. Jeff, I see your question typed here in the chat feature. If you want to go ahead and ask it, please do. Otherwise, I can read it out for you.
Yes, thank you. What's the current situation in the, if I'm pronouncing this correctly, the Shuksan Healthcare Nursing Home, where dozens of cases were confirmed about a month ago? And then as a follow-up, are there any other locations or homes that you are concerned about?
So our team regularly checks in with our facilities that have cases. So without revealing, it's always that balance between revealing confidential private health information and the status of the facility. But it does seem like that they're stable. They're able to provide care for their residents. There's certainly some of their residents who are recovering, and they're working on strategies to, I guess, the hospital here locally has provided a staffing team to them during this time. And so that ends here in the next week or so. And they're just taking a look at their own internal resources to continue to provide care for their residents. So we work with them closely still around symptom management and cohorting of clients, but most of the residents there actually, as you know, were infected, and they're providing details about specifics also on their social media page. And then there are other, there's a total of 2 assisted livings and 2 skilled nursing facilities here in Whatcom County that have positive cases. And so we are working closely with those buildings and their infection prevention teams and administration.
Okay, Robert Mittendorf, are you back on the call? If so, go ahead and ask your question.
Hi, thanks. I seem to be having some connection problems today. So I did send on chat. I'm not sure if you were able to see it. In case I get lost again, it is there. But I had sent some questions last week asking about spending at Whatcom Unified Command and didn't get a response to those questions by email. And I was wondering if you had seen those questions, if you could detail spending through the latest operational command. Also wanted to know like how the operational command period works, like how long are they, et cetera, to get some sense of budgeting.
This is Melissa Morin again. So the staff that we have on the call today are specifically with the health department. We aren't able to answer questions about Whatcom Unified Command, but Robert, I'll go ahead and follow up with you offline after this call, and we'll connect with others in the Joint Information Center to make sure that we get your questions answered.
Hey, thanks, Melissa. I appreciate it.
It looks like we have another question from Joe Tehan. Joe, go ahead and ask your question. I think that we may have had some connection issues with Joe as well. Key,
I had to turn my microphone on, sorry.
Oh, no problem. Go ahead, Joe.
Okay. As far as testing, and I know that it'll take an order from the governor before our entire economy is reopened, but on the local perspective, we're hearing that we'll need, really comprehensive testing of our population and then isolating those who test positive for the virus to really be certain that we can be safe in opening up our economy. And I guess, do we have the potential to have that expansive of a testing protocol? Is that a ways off, or what are we looking at here locally?
I think that, so we have a coalition of community healthcare providers meeting weekly with our deputy health officer, and we're able to, gather information from different clinics and practices around the county about what they have available and systems that they set up. And so we know our larger healthcare systems, including our community health centers, are set up for telehealth and also for testing either through a drive-through or an outside clinic area. And so, and it also reports that they are able to expand and contract to staff those as the need is there, which is similar to our health department drive-through testing as well, the ability to expand and contract. And we have adequate PPE, so that's an important part.
Okay, we have another question from Key Raylia at the Herald. Key, go ahead.
Okay, thank you. This is 2 questions. One, Erica, I was wondering if you have a date for when the task force will convene. And then my second question has to do with testing as well in terms of trying to get a general picture of how many tests have been conducted in Whatcom County. Early on, I think the information that was flowing to the health department through the state disease reporting system was, my memory is that it was only the tests that came out for, came out of Shoreline, test results came out of Shoreline. So can you tell me where you're getting the information right now about negative tests? And then also, Erica, back to my first question about the task force and when it might be convening. Sorry about that. Long questions.
Sure, I can start. Thanks, Key. I'm hoping that this task force will be able to convene next week. This is all a very expedited process, and the PHAB members, our Public Health Advisory Board members, agreed on Friday. So we're moving quickly, and I want to make sure that we have the right input from the right sectors. And so there'll be a lot of work this week to make sure that we have good representation of those sectors and individuals that will be helpful in moving this process forward. So my hope is next week, and fingers crossed. And I'm very glad that I asked Cindy to be on this call, because there are a lot of questions for Cindy today, and she truly is our expert. So anyway, I'll let you answer the second question, Cindy.
Yeah, the negative test results. So this is all new, that we track negative results for anything through our state system. And as you know, that system became quite overwhelmed. It seems like every day is about 3 years long. So it was probably a couple weeks ago, though, that the state reporting system became overwhelmed and not as able to track the negative numbers. So they are catching up on that now. But now we've got another new wrinkle, in that it's a great wrinkle, in that we have more labs popping up and able to do testing, but it means that they're not set up to electronically submit lab results to the state. And so one of our lab here locally that's picked up on testing, I think we estimate that there's probably close to 1,000 negative results that have not yet been tabulated in the state system. So that's definitely going to change our denominator here for Whatcom County in a positive way, in a good way for us. But it's just one of those things that we're working on behind the scenes to get the data systems to talk to each other. And then we'll probably see a little bit more of this too, as we see more point of care testing through rapid testing machines. And of course, those are done in a clinician office and not necessarily hooked to a commercial laboratory that has the ability to report that electronically. So that's another information piece that we're working on getting more streamlined.
Okay, our next question is from Ron Judd with the Seattle Times. Ron, go ahead and ask your question.
Good morning, everyone. As you mentioned earlier, it looks like we'll be moving into an era of greatly expanded public testing, and looking towards that future. I wondered if you could expand a little bit, both from a legal standpoint and a public health standpoint, your decision to decline to disclose aggregate numbers of positive tests from local facilities, workplaces, private businesses, public institutions, healthcare facilities, unless those facilities have chosen to make that public themselves.
I can answer that question. So yeah, we have in the past disclosed that type of information, but only in conjunction with these very specific facilities, and we'll continue to do so as the information, as we share reliable information. We want to make sure that it's relevant and helpful, and we want to also make sure that we abide by data standards that protect confidentiality. So every situation is monitored or looked at very carefully for when and if we will release any type of information specific to type of place of being of contact, or a residency, both balancing the reliability of the data as well as that confidentiality. So as I mentioned before, it's been really fortunate that our numbers have been low. That's a positive thing, but that also keeps us in a place where we do not share that type of information for those reasons. So moving forward, we'll continue to work with those facilities to share that information in concert with them. And that helps protect everybody's identification and the safety for the residents within any one of those facilities.
But just to follow up on that, so you're leaving it up to these individual businesses or institutions or workplaces, and it seems like there are a lot of people who feel like they have the right to know if the place that they work has positive tests in their facility. And if the facility chooses not to release that information, don't people have a right to know that? And isn't that going to be a big conflict point moving forward when more and more and more people are tested?
I can jump in maybe. I think this is that important part of the case and contact investigation work and getting people identified early. I think it's also part of working with businesses around how what's really their message to their employees about sick leave practices and staying home if you're ill, or if somebody else in your household is ill and you're supposed to be quarantined. So it's complex for sure. Our contact investigation work, though, is very much the process is to talk to the case and identify their close contacts and reach out to them as well and provide information to them. So sometimes it doesn't make sense in a 400, in a very large employer where people are spread across multiple offices, that it might not make sense to do a notification in that setting. Yeah.
But just to clarify, I'm talking about places that are used by the public. So if you have a school or a grocery store, or God forbid, the only hospital in the county, or some facility that people use has a large number of infections, just to clarify, you were leaving it up to them to release that information to the public.
We would be going back to our data standards, and if there's a large number of infections, when it supersedes the ability to protect or limits the ability to protect people's identification, then that lends us the ability to provide that information. And up to this point, the numbers primarily have stayed low in each of those facilities. So this would be a case-by-case situation moving forward. That we would be assessing and working alongside with those organizations, those businesses.
Right,
and
understood.
How we protect the public health.
Sorry, didn't mean to step on you there. So what constitutes a large number in the public health sphere? Is it 3? Is it 30? Ballpark?
Mm-hmm. Our small number guidelines is less than 10. But that also takes in the reliability of the data too. So we also look at the ability of the reliability of the data. So there's multiple factors that weigh into this. On a general scale, it's usually 10 or more.
10 or more. Okay, thanks very much.
Our next question is from Denver Pratt with the Bellingham Herald. Denver, go ahead.
Hey guys, so I have a couple of various follow-up questions. One was related to the task force about the businesses. How are you guys balancing the need for economic interests versus public health interests for businesses that are specifically surrounding like people gathering, such as like our bars and our event venues that have no way to actually be open during this time? And then my second question is related to contact tracing, Are you guys doing that by like personal interview, or are you also using like mobile cell phone data to find those people?
I can start with the first question. So this isn't going to be a one size fits all. And we know that in terms of reopening businesses. We know that for some businesses, the work will be much more streamlined and much easier than for others. We don't know what the governor will provide in terms of size of gatherings. And that may preclude certain types of businesses, like you said, event spaces from opening, which would take that out of a local decision and really make it a statewide decision. We do believe that there are administrative, behavioral, and engineering elements to certain businesses being able to open again, whether that means creating, just for example, whether that means having a restaurant that has half the number of tables it used to have so people can continue to social distance, and maybe different practices about ordering and menu handling, rather doing those kinds of things in a digital format, so fewer interactions. So that's just an example. I'm not saying that that's necessarily what we're going to do, but I think there are a wide range of options, and this is a chance for us to be creative as a community about how we can balance those two desires, creating the opportunity for businesses to open while still maintaining the essential need to continue social distancing practices, which we know work. So I think it's a push-pull. There isn't going to be a one-size-fits-all, and that's what this task force is intended to look at, and really having difficult conversations with businesses about what are their challenges and what are the barriers, and how can we be creative in working through some of those, and how can we create support for businesses that we can't work for those. So I think it's a conversation, it's an invitation for businesses to participate, and it's a chance for us to support and move our community back into a place where people are back at work, they're making money again, and businesses can start to reopen and make money as well.
And then in terms of the contact investigation work, we are doing phone interviews with confirmed cases and then reaching out to their contacts by telephone. That's our current process. There is a statewide work group that's convening rather quickly and should have further recommendations going forward.
Our next question is from Jeff with Como. Jeff, go ahead and ask your question.
Yeah, my question was already answered. Thank you.
Great. Then I believe our next question is from Brent Lindquist with the Linden Tribune. Brent, go ahead.
Hi, everyone. Thank you for taking my question. I have one question for Cindy and one for Erica, I believe. So related to testing efforts around the county, does the health department see this antibody testing as a crucial part of the fight against COVID-19 moving forward? And my other question is, how does someone go about becoming a part of this task force?
I can take the antibody testing. Yes, but I think the antibody testing is going to be a really valuable tool for us. It is going to take some time for us to have really valid and reliable antibody tests going forward. And I think it'll line up with the vaccine development. So it's all going to take some time.
So thanks for your question about the task force. It's funny, actually, I've already gotten 3 emails during this call of people who heard about it at the beginning of the webinar that are interested in participating. So we know there will be interest, and frankly, from my perspective, it will be as big as it needs to be in order to make sure that we have the right representation. And so we will make a call out later this week for individuals that are or businesses or sectors that are interested. And truly, this is a come one, come all. Let's all work together as a community to support each other.
Our next question is from Oliver Lazenby with the Northern Light. Oliver, go ahead.
Hi, thank you. I wanted to make sure I understood, first of all, that you said test capacity is at an adequate level right now. I was wondering about how many tests per day can be done in Whatcom County. And I was also hoping you could talk a little bit more about how to improve the capacity to do contact tracing.
I was just going to try to look quickly for an email. I don't have in front of me the total capacity, but I saw a report last week that we had capacity for around 1,000 tests a week between the clinical partners and the health department. And that was with where everybody was at that point in time. So the coalition meets again tomorrow, and we should be getting some more updated information then. And as you know, the quarantine's working. We aren't needing to do very much testing right now. So it's possible that agencies have collapsed a little bit, but then would expand as the need arises. And then the other question was about expanding the capacity for contact investigation work, I think, if I understood that. And we've trained a number of our environmental health specialists and community health staff that don't normally work in communicable disease. So they are trained or training this week to work on disease investigation work. I think that's going to give us a lot of capacity here at the health department to expand and contract as we need to do follow-ups. And then also there's going to be this momentum with the statewide plan as well that's developing this week.
Okay, it looks like we have 2 more questions waiting in the chat feature. We're going to go ahead and close out after those 2 questions. So the next one is from Joe Tehan with KGMI. Joe, go ahead and ask your question.
Okay, thanks. I'm wondering about the cases that, well, we've got about almost 300, going on 300 confirmed cases at this point, and pushing 30 deaths, 27 deaths, I think was the latest tally. I talked to Peace Health St. Joseph Hospital on Friday. They said they had less than 50 cases that they'd actually treated. And my question is, I guess, are most of are the deaths occurring among those people who are hospitalized, do you know, or are they occurring at some of the long-term care facilities, or and with that smaller number of, a relatively small number of people being treated at the hospital compared to the number of confirmed cases, are most people just, riding this out at home, or where are they being treated in facilities? I'm trying to sort out where people who are confirmed with the virus are, or with the illness, are being cared for.
That might have to be something detailed that we follow up with you on. I think that generally, because I don't have the answers to specifically if the hospital's not seeing them, what number of those cases then are facility-based cases versus home living. So that would take a little bit of work for us to pull that out. And Amy, did you have any other immediate thoughts about that information?
Amy, I think that perhaps we don't have your audio working. We're not able to hear you. Why don't we take a quick look at that and see if we can get you back online. For now, we'll move on to the next question, which is from Denver Pratt at the Bellingham Herald. Denver, go ahead and ask your question.
Hey, yeah, I was just wondering if this task force, if these meetings are going to be held for the public to watch, and if so, where that would be happening, in terms of a web link or something. Thank you.
Yes, because the Public Health Advisory Board is convening this group, the Public Health Advisory Board is in our code, and they are one of our county advisory boards, so all of their meetings are public, so this would also be public.
Okay, I believe that ends things for us today. Thank you all for participating. As I said earlier, this recording will be available soon today on the Whatcom County Government YouTube channel and also on the Health Department's COVID landing page. That information was sent out in the chat, so please take a quick look there. And thanks again for attending.
This conference is no longer being recorded.